Greetings. I'm Barraza, Medical Director of Munson Hospice Care. The COVID-19 pandemic has affected the entire medical system, and that includes hospice care and hospice care patients. Visitor restrictions in hospitals, nursing homes, and even in hospice residence facilities has impacted how and where patients spend their final days, weeks, or months of life. Oftentimes, unfortunately, they find themselves separated from their family and loved ones. Munson Hospice Care dedicates themselves to serving and meeting the needs of patients and their families during this difficult time, despite these restrictions. Munson Hospice Care has responded appropriately during this COVID-19 pandemic to make sure that we are effectively meeting the needs of patients, screening patients and their caregivers or families for COVID-19, and also providing appropriate protective equipment to caregivers and to nurses during this time to keep patients and their caregivers and our team members safe. One example of how Munson Hospice has come together and met the needs of patients and makes me particularly proud to be a part of the Munson Hospice team is the following. We recognized early on, within the first few days and even week or so of this pandemic and the changes that were going on, that patients and their family members were going to experience death and dying or their final moments of life in a very different way because of visitor restrictions. We knew that patients, and especially their families, were going to experience the grieving process and bereavement in a uniquely complex manner and experience complex grief. One of the benefits of hospice care is bereavement support available to the family for a year or more after a patient passes away. Many patients during this COVID-19 pandemic don't have the opportunity to enroll in hospice care services if they end up passing away in the hospital setting. Munson Hospice Care stepped up, reached out to all hospital systems within the northern Michigan region and created a bereavement program for the families and loved ones of patients who end up dying during this COVID-19 pandemic in the hospital setting, separated from families and loved ones. This is a service that is not part of the hospice benefit. It is a service that is not going to be reimbursed by payers or Medicare, for example. Yet Munson Hospice team members came together and made this happen regardless, knowing that they weren't going to get any kind of compensation for this service. It is the team members of Munson Hospice Care that recognize that it's not about the resources or about the reimbursement. It is about meeting the needs of our patients and the people in our community. Your donation to Munson Hospice Care has in the past always and will continue to support Munson Hospice Care and our efforts to meet the needs of patients and their loved ones in our community here in northern Michigan. We greatly appreciate your gift and your donation to help support not just Munson Hospice, but the members of our community who need these services during a very difficult time, not just in society, but especially in their own lives. I thank you very much for your attention and for your ongoing support of Munson Hospice Care now and in the future. Thank you.